Well, enough of that by way of introduction. I've invited my friend and colleague, the Rev Dr Mike Peat, to come and address us tonight. By way of introduction, Mike is the Baptist Chaplain at the University of Bristol. He also teaches at two theological colleges, Trinity College and Bristol Baptist College. And his academic background is a doctorate in medical ethics from a Christian perspective. Now, recently he's been invited to think about the issue of transgender within a Baptist context. And he's at the moment writing a paper that will be coming out in a Baptist European journal. So you never know, the things that you ask him tonight and respond to may well be finding a wider audience as a result. So could we share a good welcome for Mike as he speaks on can a person's calling include sex reassignment surgery? Mike Peat.
Well, thank you, Mark, for that introduction, and thank you all of you for welcoming me here today. I have to say that it's really lovely to be in a kind of relaxed environment talking about issues. I think it can really change the ethos in which conversations can happen. It's also really encouraging to see such a broad spectrum of ages and people coming as a good mix to talk about things together. So if you get wind of a similar project suddenly spontaneously appearing to emerge in the centre of Bristol, you know that I left tonight inspired. In preparing for this evening, and as Mark said, in kind of the longer term, thinking about what I've been asked to do in Baptist life, one of the most helpful papers that I read also includes one of the shortest sentences I have ever read in an academic paper about any ethical topic. The Reverend Canon Dr Fraser Watts begins his 2002 paper called Transsexualism and the Church by saying simply this: transsexualism is a minefield. And it seems to me that metaphor is particularly apt, particularly in the church. Those of you familiar with the final scenes of the final series of Blackadder set in World War I may remember that scene in which the hapless trio of Baldric, Blackadder and George briefly venture from their trench to negotiate a minefield in no man's land, in which normal procedure when treading on a mine is to jump 200 feet into the air and scatter yourself over a wide area. To consider transsexualism from the perspective of Christian ethics, I think, from what I've read so far, is to engage with a cluster of moral convictions and claims and concerns that are spread across a kind of ideological battleground. And at either end of that, there feels to be entrenched positions. People who, often for personal reasons, endorse the use of medical technology to relieve long-endured psychological distress and to free up opportunities that they've been frustrated by so far, go head-to-head with others, just as strongly convinced, but although the feeling may be understandable, the desire to change sex amounts to a transgressive co-opting of surgeon skill, rerouting it away from its proper therapeutic purpose towards becoming a commodity to satisfy consumer preferences. Those, if you like, feel like the ends of the spectrum, either end. And it seems to me that only gentle pressure applied to any of several trigger issues here, talking, for example, of mutilation, the meaning of marriage, or normal sex. I'm going to have to stop trying to do this with a microphone in my hand. All of that's liable to be explosive, bringing hurt not just to those directly involved, but also to unprepared bystanders as well. Transsexualism in the church is a minefield. And I want to be honest with you right at the beginning and say that I really do feel like a newcomer to the ethical exploration of sex reassignment surgery. Mark has already told you a little bit about how I've come to this. I have thought and taught about Christian perspectives on matters to do with both sex and medicine for a while. But when it comes to bringing these topics together, intersecting them at the point of sex reassignment surgery, I really do think I am a novice with much to learn and plenty of unfinished business to attend to. Sex reassignment surgery is not part of my own life story. I personally have never suffered from what is called gender dysphoria, an enduring feeling that the gender I perceive myself to be is out of kilter with the biological sex I was born with. I am very sure that I need to keep receiving the insights of others, speaking from their more direct experience, to begin to redress this limit to my understanding. So I'm hoping that this evening I will learn from you, whatever your experience has been, as much as offer you my thoughts about approaching moral questions about sex reassignment surgery. You'll certainly get more of a hint of where my sympathies currently lie, but what I really want to do this evening is just to open up areas for exploration. I don't want to aim to persuade you to reach particular conclusions, like an electoral candidate seeking your vote. I strongly suspect that in the weeks to come you will get plenty of that as it is. What I'm going to do, as Mark said, is talk for 3/4 of an hour or so. But along the way, I'm going to take one or two brief pauses, because I think there are times where it will be useful just for you to have a moment to digest what's been said before we move on to the next bit. In those moments, I'm quite happy for people to kind of ask if they want me to clarify anything I've said. What I will want first and foremost in those times, just to make sure, is that you're kind of with me and nobody's feeling completely lost. The kind of questions or comments or criticisms, if we can kind of save them until the bit at the end, I think you'll get the flow better. But there will be moments along the way where I'm just going to stop and say, are you all with me? Is there anything you want me to explain further? Okay. So as I say, what I want to do this evening is focus on two questions. And I think the latter question builds on the former one. Those two questions are as follows. Firstly, does sex reassignment surgery, and that seems to be a common expression for it, does it necessarily violate our integrity as embodied creatures? And the second question, are there features of transsexual people's experience that we can regard as pointing to a valid and a distinct vocation, a calling from God? Those questions are going to be the focus, and because time is against us a little tonight, some of the questions that arise around transsexual surgery will end up receiving a rather cursory treatment than they really deserve. It may be that you had hoped I'd unpack something more than I'll have time to do. One of the casualties of time, I think, will be exploring that question of how we think about transsexualism and marriage. That, I think, deserves a whole evening in itself. So I've put these two questions, and perhaps the form of those two questions reflects the Christian worldview that gives rise to them. And it's worth, I think, just spelling out the main features of how I see that worldview as we go into them. What I mean by this is that questions I'm putting, the two questions I put, take their cue from the claim that human bodies are part of a creation which, because it's God's creation, has been declared good. Declared good by a loving creator. That said, in one way or another, each of our embodied lives shares in a reality that we're alienated from God's original creative purposes. Theologically speaking, our bodies participate in an all-pervasive reality of sin. In Jesus' bodily resurrection, creation generally, and so also our bodily lives, have been redeemed by God. They can anticipate being renewed in a future new creation, something which through God's Spirit is already starting to unfold now. And when I speak of vocation, I use that term quite broadly. Vocation really refers to the idea that each of us is called by God to our own particular tasks, And these tasks help to bring out kind of anticipatory glimpses of God's future renewal. Bring them into the light here and now. One way or another, through our callings, we all play a part in building up that community together called the body of Christ. And the body of Christ is to be a sign in the present, albeit a faint sign that gets things wrong, but a sign nevertheless of what transformed life together in God's new creation will become. That, if you like, is the backdrop, the vision that's behind the questions that we're exploring. And I think you'll see why I think it's useful just to paint it first, so that we can refer to it quite easily along the way. So, let's consider that first question. Does sex reassignment surgery necessarily violate our integrity as embodied creatures? I think this is a core concern that underlies the unease that's often heard within the Christian church about transsexual surgery. And it's been very well articulated by the theologian Oliver O'Donovan. Oliver O'Donovan, I think, manages to articulate what others are sometimes feeling but find it hard to put into words. And he says this. He says, if I claim to have a real sex, which may be at war with the sex of my body, and is at least in an uncertain relationship to it, I am shrinking from the glad acceptance of myself as a physical as well as a spiritual being, and seeking self-knowledge in a kind of Gnostic withdrawal from material creation. What I think this quote is getting at is a widely felt concern amongst Christians that looking for surgical ways to overcome gender dysphoria shows that the people involved and the medical professions that collude with them have fundamentally misunderstood what it means for us to have been created by a God whose purposes are loving. According to this line of reasoning, here the transsexual person's experience of dissonance, of being in tension between their body and their mind, has led to this overall perception that the body they've been given is really a problem that has to be resolved, rather than a gracious gift to be received, first and foremost, as a good. And you see a hint of this thought process where O'Donovan refers to that line, Gnostic withdrawal. What he's referring to is a doctrine which was ended up becoming quite widely discredited back in the early church time, when Christianity was becoming established. And amongst other things, what Gnostics used to believe was that the material world in general was a bad thing. It was an evil, and our salvation took the form of getting away from it, becoming kind of disembodied souls that escaped from the dungeon of the prison of our bodies, of our matter. What O'Donovan does is associate this ancient world-denying view of Gnosticism with this contemporary anxiety that sex reassignment surgery amounts to a desire to be rid of something given and material, the structure of a body, to treat its biology as dispensable because the mind wishes the body were other than it was. But I don't think that's just what's going on. I think the concern that O'Donovan has managed to put into words here, for many Christians, it's become elevated into this kind of ideological trench I mentioned at the beginning. And that's because those who are concerned interpret the whole phenomenon of sex reassignment surgery not just as an isolated case, something the church is dealing with on its own. It's seen to be one of a variety of strategies and a very insidious kind of cultural shift that we're all caught up in. A shift towards treating matter, towards treating our bodiliness as a kind of raw material, something that doesn't have a form of its own, that would give us moral boundaries over against our choices. Something which, in principle at least, we need feel no inhibitions about rearranging as we see best. Removing and remodelling genitals to align a person's body with their sense of gender identity, as sex reassignment surgery typically does, is then viewed from this vantage as bound to epitomise a distorted understanding, a wrong attitude towards creation as a whole. And the argument goes, Christians need to make every effort to avoid this big cultural shift, and therefore we must stand against transsexual surgery. When O'Donovan responds to transsexual surgery, he echoes a point that he's pressed more generally, that really, in a way, his kind of work has been about. The general point that O'Donovan has often made is that in the gift of creation, God doesn't just provide us with a material to be in, God gives creation its own order. It has an intrinsic coherence of its own. It's not always easy to discern what that should look like, but it exists apart from the way we evaluate it. That's the important bit for him. That there's something about creation which is an order, a coherence, an intelligible structure that's quite apart from what we choose to do with it. And to return for a moment to that backdrop Christian worldview, it's part and parcel of acknowledging that we share in the reality of sin to say that if we're left to our own devices, our reasoning is liable to mislead our moral choices, sometimes in quite surreptitious ways. A general claim like O'Donovan's making doesn't mean that we just need to accept anything and everything that comes to us just because it comes to us from outside of ourselves, from creation. It doesn't deny that we need ever use surgery to respond to something that happens to our bodies. But it starts with assuming that creation as a whole, because it's God's creation, has an order that's good apart from our ordering of it. Our interventions should be marked then by caution and restraint. As O'Donovan himself puts it, our moral task is to discern the given forms of the material world, to respect them, even while sometimes conferring new forms upon the old. And this is one of those moments where I think I want to pause. We'll get in a minute to how I would like to respond to all of that, because so far what I've done is actually just sketch a line of reasoning that I think goes on. But here I just want to pause and look and see how many furrow brows there are around. Is this making sense? Is there anything that you feel you'd like me to kind of unpack a bit further, just by way of clarifying? Yes.
I understand you that people have taken this view as regarding it as an extreme form of cosmetic surgery, and it's sort of thin end of the wedge, liposuction, breast enhancement.
Yes, I think sometimes that is the case. I think I'm not suggesting that there's a lack of sympathy necessary. I think that this isn't just a kind of. I think often it's not a case of saying, well, this is just selfishness, or this is just a kind of willful. What people are wanting to say is that it's all part of the same slippery slope, if you like. That actually, although we might understand a little bit, and our sympathies might recognise that actually here's somebody who is dealing with distress and looking for this response. Nevertheless, it's not qualitatively different from a moral point of view to do that than to do a kind of cosmetic surgery that you desperately want. Okay. Does that help? Yeah. Okay, so here are some of my thoughts on that perspective. I think when he's speaking at that general level, I think O'Donovan has many things that are right. I think he's right that creation has an order. I think he's right that what moral reflection is all about is something to do with discerning how we honour an order which we didn't just create and choose of ourselves. I think he's right that moral claims are about making respect and restraint appropriate ways of managing our choices about how we change our bodies. I think he's right in a lot of what he says about the cultural context in which we make our moral decisions. I think at the moment there is a bit of a tendency to assume that as far as possible, the material part of our lives should always be governed by our will through our personal choices. One of the things I do at Bristol University is meet with groups of first-year medical students to explore a kind of introduction to medical law and ethics. And one of the things that becomes very clear when you run that course is that autonomy, the freedom of the patient, is a really reigning supreme as the principle in our medical law. You know, of all the concepts we might choose, autonomy seems to trump them all in most cases. I also think that increasingly the definition of a patient in medicine is becoming ever more synonymous with the definition of a client in everyday use. But, whilst I agree with Donovan that there are a lot of things going on culturally and in general terms to be concerned about here, what I'm not convinced of is that this general truth necessarily carries the implications for transsexual surgery that O'Donovan seems to claim for it. At least not in every request or search for this surgery to resolve an experience of dissonance between gender identity and body. Although it remains influential today, that essay I've been talking to by O'Donovan, what he published as a Grove booklet called Transsexualism and Christian Marriage, he published it in 1982. And like a number of prominent Christian treatments of this topic, O'Donovan seems to assume, without really elaborating on his reasons, that gender dysphoria is a matter of psychology. What this assumption seems to me to obscure is that actually there's a lot of complexity and a lot of uncertainty about the causes of gender dysphoria. Although it's comparatively rare, it's a phenomenon that presents itself in different ways in different people. To such a degree that actually it's quite doubtful that any one theory of its cause is ever going to apply equally to everyone who experiences it. It's a very complicated thing. And the assumption that this is a problem that's really all in the mind can only be made, I think, by ignoring some of the scientific research that tentatively points towards several biological factors that contribute as well. So, for example, scientists have discovered that testosterone present in a mother's womb contributes to the development of male genitals at an early stage in a fetus's development. Testosterone also contributes to the development of a brain predisposed to more characteristically male behaviour patterns. I'm not enough of a scientist to unpack what that means, but what's called a male differentiated brain by scientists. Testosterone contributes to both of those parts, but it does so at different stages along a fetus's development. So there's some evidence to suggest that at least some people who experience this dissonance between their gender identity, their self-awareness, and their bodies may do so partly because early on in fetal development, testosterone developed male genitals for them. Later on, a different level of testosterone meant that the brain didn't develop as a male differentiated brain. So you have there, in physical terms, one kind of biological reality and another kind of biological reality. The result, male genitalia and female differentiated brain, as scientists call it, all in one and the same body. Other research has looking at the way brain structures in people who suffer from gender dysphoria compared with non-sufferers gives us some reason to think that there may be a kind of brain structure element in this to do, a neuroanatomical difference. All of this is tentative. The kind of sample sizes that are explored are very small, and broad claims would be unwise, but there's enough, I think, to unsettle any glib claims that gender dysphoria has a psychological cause, and it's only psychology that we could look to for a resolution. I suspect that the reluctance amongst many Christians to take seriously that there is a potential biological cause as well as psychological factors for gender dysphoria may owe something to the way in which first impressions leave their mark. And we all know that experience, that you get a first impression of someone or something, it's very hard to shift. When research into gender dysphoria was still very much in its infancy in the early 1960s, data was collected from about those who were seeking surgery to resolve their experience of gender dysphoria, but it was being collected from clinics dealing with a variety of psychological disorders. Consequently, the claims that were made out of this data were based on studying a particular kind of transsexual experience. They were based on studying people who were already in clinics experiencing things like depression and bipolar disorder and other experiences. It's a bit like, and I can't remember exactly where I heard it from, but somebody once described a kind of a rat catcher trying to work out how big the rats were that were scurrying around in his sitting room. So he laid a trap, and then when he got up in the morning, he looked in the trap, there were rats of a certain size. Ah, that's how big rats are, he thought, forgetting that actually some rats might have been too big to get into the trap, some rats might have been small enough to get back out again, so did he have a representative sample? It's only a thought experiment, I am not making comparison with rats. Do you see what I mean? The way in which the study was constructed in the first place may have skewed the way in which research was undertaken and results were found. And the legacy of these first impressions, I think, can be seen, for example, in quite an influential report that was written in 2000 by the Evangelical Alliance about transsexualism. The Evangelical Alliance report was quite prepared to say, yes, there is some research going on into the possible physical basis of this, into the biological aspects. They recognised that maybe those factors were part of various contributors to the causes, and yet somehow, as they started to come towards a conclusion, the authors of the report concluded, and I quote, "A psychological explanation is more obvious and straightforward." Why? Why more obvious? Why more straightforward? It didn't seem to tally with other things that had been said. And I think the danger is that a claim like that risks giving the impression that having a psychological strategy for overcoming gender dysphoria is also obvious and straightforward. We just need to find it. In reality, gender dysphoria has proved extremely resistant to psychotherapeutic intervention. So there does seem to be this mismatch at various points with the assumption that the experiences is all in the mind and it's the mind that needs to be sorted, and the reality that actually psychological strategies don't work well, and research would suggest a much more mixed variety of physical and psychological causes. Why is all this important for Christian qualms about altering the sexual anatomy of our bodiness? Well, I think it's because if there are biological factors at work in the causes of gender dysphoria, even if biology is part of a bigger, more complex picture, and I think that at least is plausible to say, then what are we to say, what are we to regard as the creator given that we're supposed to respect and honour and be restrained from changing? It seems that one part of the body is conflicting with another part of the body at some level. So which of it's given, and what do we respect? I think with that in mind, it's worth noting that one of the criticisms that was levelled at Oliver O'Donovan's views of transsexual surgery, a refusal to accept what's given in the body, is that in the same paper he also seemed entirely at ease with saying that surgery on people who have what's called intersex conditions, sometimes known popularly as hermaphrodite conditions, surgery on that's fine, as far as he was concerned, even though similarly it's actually intervening on the body and removing or reshaping healthy tissue. In order that the body of someone who has one of various unusual combinations of male and female sexual characteristics may be more visibly and functionally according with male or female, O'Donovan is even prepared to say that after surgery, and I quote again, "The resulting sex is the real sex of the hermaphrodite. That is to say, it's the sex to which, in view of the ambiguity, it is sensible to assign him." In fact, when you start to read some of the stories of people who have had intersex and experienced having surgery at a very early age, which used to be the standard way of responding to it some years ago, what you hear from a lot of people is actually it didn't seem to them very sensible at all to assign them to one of two particular sexes at an early age. In fact, a number of people who were operated on in early life then said as adults they'd have rather lived with that unusual anatomy they were born with than spend the rest of their life suffering from the scarring that was left by that operation and with kind of moulded genitals that didn't actually function and were not as sensitive as they might otherwise have been. So the picture of that kind of surgical intervention is actually much more of a mixed blessing. Now, in fairness to O'Donovan writing in 1982, I think a lot of that picture may have altered his perception now compared with 30 odd years ago. A lot of the story of what adult people who experienced early surgery on intersex conditions have experienced, a lot of that's come to light more recently. But I think the assumption that one kind of bodily condition very easily lends itself to surgery and one is a problem seems to reinforce the question, what's the yardstick? What's the yardstick that we should use to measure when surgically changing a body that's given to us is right, if just the fact that it's given is not itself an unconditional moral claim? How are we doing? Anyone want to just ask me to clarify anything? I think you're all very polite, thank you. So, with that in mind, I'm just going to bring into the mix another theologian, someone called Robert Song, somebody who, rather like me, is sympathetic to the general tone of what Oliver O'Donovan claims about a created order, but is also cautious about the scope of this general rule. And he seems to capture the dilemma in theological terms for what it's like when our biology in itself gives off conflicting signals. Signals that make it harder for us to discern what we need to do to respect a created order in this example. Robert Song says this: in these kinds of cases, the body does not here point unequivocally to the goodness of creation, but has in its divided nature also become a sign of the fallen creation. In a case such as this, it's much less clear what the practice of healing being a sign both of the restoration of creation and the fulfillment of the kingdom, what healing might look like in this case. Now, interestingly, the case that Song has in mind is another even rarer condition, a condition called body integrity identity disorder. I hope I'm not blasting you with too many new medical terms. Body integrity identity disorder is a phenomenon in which a person has a long-standing and desperate yearning to amputate a healthy limb because they are convinced that removing this limb will actually leave them feeling more whole. It's very rare. Has anyone heard of it before? Yeah, one or two people, good. It is an unusual condition, and like gender dysphoria, the cause of this feeling of dissonance is uncertain. It may also be this complex, varied constellation of factors whose contribution differs a little in each example. To be honest, there are too few examples to draw any general conclusions. And like gender dysphoria, this phenomenon takes the form of someone having a very deep-seated experience of dissonance between how they perceive themselves and what their body is actually like. But unlike gender dysphoria, this condition, body integrity identity disorder, does not as such raise questions about whether someone's true sexual identity is being made, or perhaps better revealed, by surgery, depending, I suppose, on which body part you're desperate to have amputated. Generally, to look at body integrity identity disorder as an example of potential surgery on a given body, it doesn't take us into that incendiary territory of whether post-operative sufferers can end up being properly married, which is where a lot of the conversation about transsexualism goes on in the church. And I think because it's different, it has the advantage for us, looking at what it means to uphold bodily integrity, it has the advantage that, as an analogous case, it allows us to home in specifically on this question of where the boundary between surgical intervention should lie. What does it mean to respect the given intelligibility of what's given in the material world? Where might surgery transgress this boundary? And in a way, it kind of filters out the questions that can obscure that specific question. So that's why I think it's worth bringing in this very unusual condition. After considering various other kinds of surgical intervention that, one way or another, relate to surgery for body integrity identity disorder, Robert Song concludes that the moral aspects of amputation surgery for this condition probably most closely resemble past discussions about the use of lobotomy surgery to treat severe psychiatric conditions. So what he does is go looking for something in, if you like, the history of moral reflection that may help him think about this very unusual condition. And lobotomy is the place that he thinks there are some important, significant connections. And his conclusion is that the way to think about appropriate surgery in this instance is given to us in an instruction that used to be given to Catholic hospitals where lobotomy surgery was undertaken. And this is what the instruction said. It said lobotomy and similar operations are morally justifiable when medically indicated as the proper treatment of serious mental illnesses or intractable pain. In each case, the welfare of the patient himself, considered as a person, must be the determining factor. These operations are not justifiable when less extreme remedies are reasonably available, or in cases where the probability of harm to the patient outweighs the hope of benefit to him. So it's a long quote, but what I want to suggest, and we can have some further conversation about them later, what I want to suggest is the advice you hear there in that instruction also gives us a defensible basis for thinking about times when sex reassignment surgery could be reasonable to do. But that assessment, I think, needs to happen on a case-by-case basis. In any particular case, surgery would respect or transgress the meaning inherent in our given bodies if we think about the severity of suffering, whether surgery is a last resort, what the balance of risk and benefit looks like, and above all, I think, all of these things are governed by what it means to think about the welfare of the whole person. The whole person. What I mean is that one of the things that's been bothering me is that a lot of attention is given just to the body as material. It doesn't really recognise that the whole person is always what Christians call a psychosomatic unity. But actually, our minds are as much a given part of creation as our matter, our flesh and blood. And we needn't necessarily assume that what's going on in the mind is of secondary significance to the material that embodies us. I'm going to pause again. I've put various things out there. Does anybody want to ask me to clarify anything?
The psychosomatic union thing,
Mm-hmm.
would that necessarily imply the mind is non-living?
No, I think it implies that actually the mind is always dependent on the physical, that you couldn't kind of separate them out. So actually in that respect, this is one of the reasons why the early church saw Gnosticism as deeply problematic, because there's always been in Christianity a strong drive back to the Jewish creation view that human beings are souls of their bodies. We don't have disability souls, we are embodied all the time. That the relationship between our minds and bodies is inextricable. But what I want to suggest is that a lot of the conversation about transsexual surgery has said, what should we or should we not do to the body, given that this is about perception? But whereas I think if you take the whole person, then it becomes less clear why we need to be concerned about using surgery on the body to respond to a difficulty that the mind is communicating to us. Yeah? Psychosomatic. Yeah. There's a variety of terms. I think the one I've found used most often is sex reassignment surgery, and I admit that I'm... Pardon? Is it gender reassignment? The thing is, gender is often perceived as, gender is perceived a lot more to do with a construct that's partly informed by the culture around us. So actually how we make sense of gender is a construct. So what I've read, and again this may come from, you may be helping me towards a place where there's a different understanding, but sex reassignment is used to specifically talk about the fact that these are biological changes. Gender seems to be a much more much more to do with how we perceive and make sense of the world around us. But I take that point on board. So is it the Tavistock clinic, you say, using gender reassignment surgery? Yeah. Well, interesting. I mean, one of the things I want to come on to say is that I have a problem with the expression sex reassignment surgeon, because I wonder whether actually we're talking here about sex. We're not are we really changing people from one sex to another because we're changing their bodily anatomy? Are we assigning them a sex, or are we helping them to discover a sex? I think that's where the language can sometimes kind of obscure, fudge the issue a bit. But thank you. I will look into the Tavistock clinic's term. Yeah?
Yeah, it's not exactly a clarification, but a question that's kind of hanging in the air for me.
Yeah.
Is, I think it'd be helpful to say a word about the success rate of sex reassignment surgery. How much, in the broadest term, does it work?
Broadly, from what I have read, yes. The difficulty is it's often the success rate is used, and the success rate is kind of thrown around within a kind of political ideological conflict. So often success rate is described according to the position people, the agenda people have using it. So it's often, I find, quite difficult to get it kind of clear what's the success rate. But it does seem that more often than not, most of the time, if you get to that point where you do undergo the surgery, and one of the conditions on it is that you actually, before you even undergo surgery, you spend at least a year living in the gender that you're about to assume. So actually, you've had a lot of time to assimilate, and get used to being related to, as is more common. Somebody taking on a female persona who have been born a male. That's more common. So actually, because of those safeguards, I think if you actually get to the point where you have surgery, you're pretty far down the line in terms of your assumptions. I don't think you're allowed to do it too kind of prematurely. That said, I don't want to suggest at all that every outcome is successful. There certainly are stories of people who have regretted and wanted to change back. But I don't think I think they are very much the minority report. Okay, I'll press on, and then we'll have a chance to have a break and get into more of a question and answer. How are you doing? Yeah. For reasons I think I've kind of made clear, I want to stay with Robert Song's thinking about body integrity identity disorder for just a little longer. Because one of the things I think is very useful about his kind of looking into this is that not only has he found a way of conceptualizing the possibility that when you amputate a healthy limb to alleviate mental anguish, you're doing something that certainly under certain circumstances is morally reasonable. I think what he then goes on to say is to put in place some very important caveats, and these caveats I think lead us into this other question that I want to consider, the question of vocation in relation to transsexual surgery. Robert Song raises two grounds for caution, having pointed out a way in which it could make sense in certain circumstances. He has two words of caution. And the first is a reminder of the kind of disquiet we began with, that Oliver Donovan was expressing. The idea that surgery here may be one more step on a slope that's made especially slippery because we have this wider cultural predilection for treating patients as consumers, for treating their personal choices over their body as the de facto goals of medicine. What's different, I think, when Song deals with this broader cultural question is that what he's concerned here, what he does really is more plea for special vigilance than say we're not going there because it's, because it's kind of playing into a false cultural strategy. You might say it's the difference between treading on a mountain path that's all the more carefully and walking in shoes with good grips because you're always mindful that there's a slippery slope just a few inches to your left, or refusing to go out on that mountain path at all because there's this slippery slope a few inches to your left. Do you see the difference? One theologian wants to say, dangerous territory, let's not go there, it's part of a cultural malaise. The other wants to say, yes, the cultural malaise is there, But if we keep it constantly in mind, if we're very careful, if we scrutinise our cases, if we really think carefully about what we're doing, then yes, it's possible in certain situations. Okay? So that's one of his grounds for caution. Just be aware of the cultural context in which this is happening and we're exploring it. And the second ground he raises for caution is really in some ways a specific form of the first. Because he wants to make the point that there is always this danger that when you have a diagnostic category, when you've given it a name, when you've had a set of symptoms associated by it by authoritative figures, normally medical authoritative figures, it becomes quite seductive to then start to interpret experiences in the light of the diagnostic category that's out there. Yeah? This is how Song puts it, because I think he puts it perhaps more clearly than I'm able to. He says, because there's a reciprocal reflexive nature to the relationship between people's self-interpretations and the diagnostic categories available to them, especially when it's mediated through support groups, internet blogs, information sites, and the like, such classifications can end up structuring the ways in which people perform their mental torment, in ways that end up precluding alternative interpretations. This can leave them grasping onto their identity as sufferers, as if that condition is the deepest truth about themselves. It can leave them clinging to the possibility that surgical intervention is their only hope of salvation, and they're unable then to ask, even in principle, whether there are any alternatives. To try and simplify that, it's basically, we have the internet now available and people love to kind of self-diagnose before they go to the doctors. You find something, you think, oh yes, that's me. Yeah, I do that, oh yeah, that's me. That's it. And then suddenly you've kind of got drawn into putting yourself, you've almost kind of projected yourself into the category. If the diagnostic category wasn't there, would you describe your experience or act out your experience in the same way? That's what he's talking about, this kind of feedback loop between what we name and then how we describe our experiences. And I think that's important. I think it's a useful thing to be very aware of. Maybe to some degree it's also hard to avoid, but at least to be aware of. And in the light of all this, what I want to suggest is that perhaps the vocation of the church together, our collective vocation, is to be the kind of community where people who do experience gender dysphoria, people who are considering the possibility of sex or gender reassignment surgery, find in the church not condemnation, but also not just a simplistic encouragement to go ahead with a transition because you're thinking about it. Rather, what I want to suggest is the church offers something altogether more valuable than either of these options. What it offers, or should offer, is a welcoming space with companions who care enough to ask challenging questions. To ask challenging questions, but not to preempt the answers, not to ask questions so that we can lead people one way or the other, but just to say, is that the only way to describe your experience? Is that your only option? I will walk with you alongside it. I want the church to be a kind of community where careful thought can be given to whether what seems on the face of it to fulfill a need really fulfills it, and really is the need there as a need. I want the church to be the kind of community that holds open the possibility that actually somebody could lose the desire for surgery as much as they could venture into surgery. And to stay with them in that for as long as it takes to establish what for them will be the wisest choice. In short, I think the church needs to be a community willing to share open-mindedly and wholeheartedly in a process of discerning this person's vocation and the form it will take in relation to their transgender experience. So in a way, I think I've got to give you an answer to the question that is the title of this whole talk. Do I think a person's calling can include sex reassignment surgery, or to be more precise in my mind, surgery that alters anatomy in a way that there's a better congruence between how somebody understands themselves and what the body they have is? The answer is yes, I think it can. I think it can. A person's calling can include sex reassignment surgery. But I don't think it necessarily does for everyone who is seeking it. As I hope has become clearer, differentiating the one from the other involves a process of discernment, possibly a lengthy process of discernment, but a process that cannot be determined in advance, really, like investigating any other vocation. Morally speaking, I think the possibility is there for drawing on sex reassignment surgery, gender reassignment surgery, as an alternative, a last resort for severe situations with a balance of risk and attending to the welfare of the whole person. I think the possibility is there, but it may well not translate into the most appealing or available option to hand. So at this point, I think it's just worth flagging up, highlighting some of the repeated instances in the biblical witness to vocation that illustrate how, when we're faithful to a calling, that doesn't always bring comfort or self-assurance. There are, if you look at the story of the way people are called, prophets particularly are called, comfort, self-assurance, confidence, it's not always there. Callings don't necessarily relate to what the easiest solution, or the solution that feels most comfortable would be. Doesn't mean it can't, but it's not necessarily the same thing. We could also pause to note the reformers, Luther and Calvin, who in their insistence that the idea of God's calling could apply to a whole range of stations and occupations, it's not just about clergy, were also very clear about the fact that what is common to the whole idea of vocation in all sorts of different stations and occupations is that it's first and foremost a calling to service to the work of God. It is not simply about self-fulfillment. If there's self-fulfillment, it comes in a more qualified way. It's first and foremost, a calling is a matter of service to the work of God. So there was another question I put. Are there features of transsexual people's experience that we might think of as pointing to something that's not just a valid vocation, but also a distinct vocation, particularly in the life of the church? Are there distinct things that transsexual people, whether they have undergone surgery or, as some transgender people do, prefer not to undergo surgery but think there is an alternative way of living with the experience they have, do they have something to offer specifically as part of their vocational service to God's redeeming work through the church? Well, some transgender people who have thought about Christian faith have sometimes found encouragement in the fact that the eunuch in the biblical picture is sometimes, not always, but often viewed in a positive light, particularly in the New Testament. I don't want to explore particular texts or particular ways in which this happened, but what I do want to do is draw attention to an observation I found recently written by the theologian Adrian Thatcher. And Thatcher notes that in the biblical world, the eunuch, and incidentally that could refer to any of a variety of unusual sexual configurations, the eunuch was always somebody who was able to cross thresholds that were otherwise barriers to those who were men or women. Could cross barriers. It was the fact that the eunuch could cross barriers that meant that they were often well placed to be messengers or mediators or communicators of government business or means of communicating between men and women in the royal court. They had an ability to cross boundaries that others were not able to do. I think in some ways it goes without saying the calling of each transsexual person will by definition be unique. The calling of any of us is unique. In many respects, the calling of somebody who is transsexual will involve sharing gifts in which their sexual features are not to the fore, just like any of us. But I am inclined to agree with those who suggest that transgender and intersex people can also offer something distinct as messengers to the church. Messengers by their capacity to unsettle our conventional boundaries. Their stories call all of us to become more aware of the complexity and the variety that's caught up in ideas of sex and gender. Do we even know what we often mean when we talk of sex and gender? Sex and gender have fluctuated throughout history. Their perspectives about them have changed. People who experience gender dysphoria, people who are transgender or intersex, They present us with reasons just to be more cautious in some of our assumptions about what it means to be male and female, what the meaning of these terms implies for our relationships. John Hare, who's a theologian and an obstetrician, for example, thinks that taking seriously the presence of intersex people in the human community, well, that actually has quite profound implications for what the church teaches about sexuality and marriage. As he says, our understandings of sexuality and marriage depend on being able to define and to recognise two sexes, male and female, to be able to assign appropriate roles to them, to define their appropriate behaviour. And that's a very challenging, provisional, open-ended task, I think. I think actually the church's ability to do that sort of defining work carefully will always be impoverished unless we take seriously the experience of people who are transgender or intersex, unless we're open to discovering through them that there is more light and truth to be brought to us from God's Holy Spirit. Thank you for listening.